Good morning. If you want to join the class, click the green Join Class button. We're going to be talking about health. Good morning. If you want to join the class, click the green Join Class button. We're going to be talking about health. Good morning.
Hello.
Hello, how are you?
Hello, teacher.
Hello.
How are you, teacher?
I'm doing great, thanks.
Hi.
Hello.
How are you, teacher?
I'm doing great, thanks.
Hello, everybody.
Hello.
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 We'll wait just another minute. We have room for someone else to join. Somebody's got an echo.
Yes.
All right, hopefully this lesson will be difficult for some of you. I think we have space for one more, so if anybody else wants to join, you can click the green button to join the class. All right, let's take a moment and introduce ourselves. Some of you were in the last class with me. We'll start with Abdullah. Tell us where you're from, what you do for work, and one of your hobbies.
Yes, I'm Abdullah from Syria. I am a telecom consultant. I work with Ericsson. My hobbies are watching movies and cigars.
Nice to have you with us. I'm going to keep you on mute when you're not speaking because there's a lot of noise in your building. Amma, tell us where you're from.
Hello, everybody. My name is Ahmed. I'm from Saudi Arabia. I work as a trainer in a technical college, and I like reading.
Nice. Go ahead, Frederick.
Hello, everybody. My name is Frédéric. I live in France, in Paris. I am an electronic engineer, and I like play football and read.
Football and what?
Reading.
Reading, okay. Good. Hazim.
Yes. Hi, everybody. My name is Hazem. I am living in Egypt. I am like to learn a new language, especially English language. Why I am here with you to improve my English language.
Tell us one of your hobbies.
Hobby, I like to learn a new language, and I am interested to learn scientific programming.
All right,
And
nice. So,
yes,
perpetual learner.
yeah.
You'll have to tell me how to pronounce your name, whoever the next student is. How do you pronounce your name? Hewen?
Hazel.
Yeah.
Say your name for me.
Huyền.
Okay, Hewen.
Yes.
Can you
Hello,
introduce yourself?
everyone. My name is Huyền. I'm from Vietnam, and I like soccer and watching movies, documentaries, news, anything.
Very nice. And Michele.
Hi there, I'm Michele, I'm Italian, and I'm studying for being a mechanical engineer. And I like music, and I play a sport. I love to running. Oh, sorry, I love running, and that's it all.
Very good. Rod. Rod, I can't hear you. Make sure your microphone's not muted.
Hi.
Go ahead.
Okay, hi everyone. I'm Rod. I'm from Peru. I don't like reading. I only like watching movies.
What do you like to do?
Watching movies, commenting on YouTube, and play some video games.
All right. And what about you, Wolf? We can't hear you. Make sure you have your microphone turned on. All right, we will pass you for now. Ziad,
Hello.
can you introduce yourself?
Do you hear me?
I can almost hear you.
Okay, that's no problem. Hello, I'm Ziad from Algeria. I'm 18 years old. I study in high school and I love to travel and programming.
Okay, good. Nice to meet everyone. Let me share the document for today. We're going to be talking about health. Who can tell me what you see in the picture?
In this picture, we can see a doctor who check a person who is at sick, right?
Good. So a doctor and a little boy, maybe he's getting a checkup, maybe he's sick.
Yeah.
We're going to start with some discussion questions. So tell me about healthcare in your country. Is it free? Do you have to pay for medicine? Do the doctors come to your house? What is it like where you are, Abdullah? Oh, Abdullah's gone. So Ahmad. Make sure your microphone's not on mute, Ahmad, and tell us about medical care in your country.
Yeah, okay. According to the hospitals, we got two kinds of hospitals, private and what's the other one? What do you call it? The free one.
Public.
Public, okay. Public hospitals and private. I should pay for the medicine. The doctors could come to the house in just case of emergencies. Otherwise, no.
Okay, good.
Yeah.
And Frederick, what's it like where you are?
Okay. Is healthcare free in your country? Yes, in France. Sorry. Clinic is free. Okay, and medicine is free again. And if the doctor make house scale, Yes, only if it's an emergency. If it's not an emergency, you don't come at your home.
Okay, good. I noticed when you said home that you had the for the English H, but when you said house, I didn't hear the pronunciation of the H. Say this word again for me. House.
House.
Yes, you got it. All right, Hazem.
Yes.
Tell us about in your country.
I want to say that in my country there are two types for the hospital: public hospital and private hospital. The public hospital can receive people from different levels living, you know, and it is more cheaper than the private hospital. But in the private hospital, I think there are a doctor who have high qualification to care the people who are sick. And I want to say also in emergency events, uh, maybe a doctor comes to see people who are sick in the house. Yeah.
Okay, so they'll
Uh,
make house calls if you really need it.
yes.
Huen, tell us about your country.
Yes, in my country, we also have a system of public hospitals and private hospitals. Private hospitals are more expensive, but they offer better service. While public hospitals are cheaper, but they are always overcrowded. And we have a system of insurance to to support patients, I think. And if a person has an insurance, he's going to pay a little portion of the whole fee while he's in the hospital. And for those who are in a lower class, they don't have to pay anything.
Okay, and what about medicine? Do you have to pay for medicine?
Yes, of course. The medicines here is very expensive.
Okay, good. What about Michele? Tell us about your country.
Hi. In Italy, we have public hospitals, but you can use also private hospital. And the government gave them what should they do. So you pay healthy with your in percentage of your salary. So if you want to go in a public hospital, you don't have to pay nothing. But if you want to go in a private hospital, you pay only in your percentage, and the government give them the other things. For the medicine, you don't have to pay medicine if you really need it. If you don't really need it, the government pay an half, and you have to pay the other half. But the medicine are not too much expensive.
Okay, and do doctors make house calls?
Sorry, can you repeat that, please?
Do doctors make house calls?
I didn't really understand.
Question number 3.
Oh yeah. Sorry.
Question number 3 on the document says, do doctors make house calls? So in Italy, do doctors make house calls?
Oh yes. Yes, you can call a doctor, and the doctor can come in your house.
Okay. And Rod, tell us about your country.
My country is almost the same than other countries. Yeah, we have public and private hospitals.
Is there any free healthcare?
Healthcare, no, it's not free. as I was saying, private and public hospitals, and you have to pay an insurance. You have to work. You have to be. I don't know how to say that. Mm, Insurance. You have to have insurance, and you have to pay the appointments and some medicines.
Okay, so some medicines are paid
public.
for by the insurance.
Yes, in public hospitals.
And do doctors make house calls?
I'm not sure of that. No, I'm not sure of that.
Okay, well, we won't break your arm to find out. Ziad, tell us about healthcare in your country.
Um, uh,
Ziad, are you there? I can't hear you.
hello, hello, hello. Can you hear me? Hello.
All right, we will pass you for now. I want to know this question, number 10. Have you ever broken a bone? So, Rod, we'll start with you. Have you ever broken a bone?
Bone, no. I've never broke bone.
Never
Never.
broken a bone. Okay, what about you, Michele?
Yes, I broke a bone when I was younger. I was 11th. Yes, and I broke a bone when I was playing while I was playing football with my friends,
What
and it
bone?
was horrible.
Which bone did you break?
I broke the biggest bone in the leg, but
The femur.
not the femur, the tibia.
Okay, in the lower part.
Yes, in the lower part, and it was horrible.
Yeah, I don't breaking a bone's never.
I had to have a cast.
Okay. What about you,
Yes.
Huen? Have you ever broken a bone?
I broke 2 bones.
When and how?
I fell, and it was when I was at grade 5, maybe 10 or 11.
What were you doing when you fell?
Wow, actually, I was playing with friends and I fell, and I don't know. It's just like I broke my bone.
Which bone did you break?
My left hand bones.
Your hand, okay. What about you, Hazem?
I have never broken a bone, and I wish never have broken a bone in my life.
Yes, we are in the same boat. I have never broken a bone, and I never want to. What about
Yes,
you, Frederick? Frederick, are you there? Make sure your microphone's not muted and tell us, have you ever broken a bone? All right, we're passing Frederick. Ahmed, have you ever broken a bone?
No, never. I was a good boy and still.
All right, what about you, Abdullah?
Yes, I broke my hand 3 times. My left hand.
You didn't learn after the first time?
No, because the first time was when I was 8 months old. Just. Of course, my parents told me that. And the second one, I was 7 years old. I was playing with my brothers. And the last time I was 15 when I was playing soccer.
Okay. Good. So we're now going to talk about some different treatments in your country. So choose 3 things and tell me what treatments they use in your country. We'll start with Abdullah. Tell me about either a cold, a headache, the hiccups, a toothache, minor aches and pains, a bee sting. Let's pick 2. Pick 2 and tell me what you would do.
Yes, I will talk about headache.
Mm-hmm. What do you do
Okay.
when you have a headache?
I usually take some medicine like Panadol, and if I didn't get better, I go to doctor.
And what do you do when you have a cold?
The same. I use, but not medicine. I take what it's called, uh, a natural medicine like flowers. What it's called?
Is it a drink?
Yes,
Like tea?
herb.
Okay,
Herb.
herbs.
Yes.
Herbs, yep. Good. What about you, Ahmed?
Yeah, okay. The time I got hiccups, I drink water.
Okay.
Okay, and the time I got toothache, do you know cloves?
Cloves, yep.
Cloves, yeah. I put some powder cloves on that teeth or tooth. Sorry.
Interesting. And that
Yeah.
makes the toothache go away.
Yeah. It could kill or yeah.
Never heard of that, okay. What about you, Frederick? Tell us what you would do if you got a bee sting. Frederick's still not there. Hazem.
Yes. Usually, sometimes I suffer of when I have a cold in the winter season.
What do you
Can you hear
do?
me?
Yep, I can hear
Yes.
you.
When I have a cold, I feel sleepy, and I become lazy. I don't move anymore and
So you,
stay in my bed.
good, so you
And
rest.
yes, I take rest when I have a cold.
Yes, rest
And
is the best.
yes, and usually I take painkillers and drink some of lemons juice. Uh, yes, and maybe I put wet clothes on my forehead to
Okay.
decrease the temperature when I
If you have a
have
fever.
yeah, a fever.
Good. Huan, tell me what you would do if you got a bee sting.
Yes,
Me?
bee sting. Do you know limestone and lime?
Sorry, what?
Lime. I call it
Lime?
lime. Yes.
Like the fruit of a
Limestone.
lime? Oh, limestone.
No, no.
What do you do with it?
Yes. Yes. Whenever I get a bee sting, I wanna put just a little lime on the sting, and it will get much better.
It makes the pain go away?
Not really go away, but it relieves the pain.
Okay. Interesting. Michele, tell me what you do if you have a minor ache, like your shoulders or your knee or your foot or something. You have an ache, your back hurts. What do you do?
In general, I wait until that he will go out, that he go off. But if it is very hard, I can have a painkiller.
Okay.
Yes,
And
or paracetamol.
or
That's
what?
similar. A painkiller again.
Okay, a type of painkiller.
Paracetamol. Yes, and then I can feel good.
Good. And what about you, Rod? Tell us what you do when you get the hiccups.
Mm, hiccups. I don't know. When I was a kid, I didn't try anything about hiccup. I only I only stay on my bed, lay on my bed, and wait.
Okay, so you just have a lot of extra patience. And Wolfie Wolf, are you there?
Yes, yes, I'm here.
All
Yeah,
right, tell us what you do when you get a cold.
cold. Yeah, so basically I go to the doctor. And yeah,
And you do whatever he tells you.
yeah, of course, because
Okay,
yeah, he's a doctor. Yeah, I think he gives some just a prescription or something like that. Then I go to pharmacy or drugstore. I take a medicine.
very nice. In the United States, you have to have a prescription for most medicines, but where I live now in the Dominican Republic, you don't have to have a prescription for anything at all.
That
For anything at all?
Nothing.
Okay.
You just go to the pharmacy, you can get whatever you want.
Okay.
All right,
since
we're going to talk
so
about parts of the body. Did you have a question? Did anybody have a question before we move on?
No.
No questions. All right, Abdullah, do number 1 for us. Which part of the body is that?
Sorry, can you repeat your question?
In section B, name the body part. Can you do number 1?
This is used to smell noise.
No,
Nose.
no.
Let me hear you say it one more time. Nose.
Nose.
Yes. Nose is used to smell. All right, Amma, number 2.
Okay. These are used to chew. Teeth.
Yes. Good job.
Okay.
Hazem, number 3.
This is used to think brain.
Brain. Yes. Huen, number 4.
This is facial hair on the man's cheeks and chin. Bird.
Beard. Yes. Good
Beard.
pronunciation. Make sure when you say beard that you get the D at the end, just like Huen did, because if you don't have the D at the end, it's a different English word. Beard. Nice pronunciation. Michele, number 5. Michele, are you still there?
Yes, I'm here. These are used to pick things up. It could be fingers or hands.
Good. And number 6, Richard.
This is used when you swallow food. It is a throat.
Good. Throat. Number 7, Rod.
This is hair over the lip. Mustache.
You got it. Rod, do you have a mustache?
No, I don't want to. You the one.
Me either.
That's
I hope so.
nasty.
Yes.
Number 8, Wolf.
I think his neck.
Read the sentence for us.
This connects the heat to the body. The neck.
Yes, the neck connects the head to the body. Let me hear this word one more time. Head.
Head.
At the beginning with the H, the letter H in English says so it's head. Let me hear it one more time.
Head.
Nice. All right. Ziad.
Hello, can you hear me?
Yes, I can hear you. Number
Okay.
9.
Wait, the picture is not okay. This joint allows your arm to bend. I don't have an answer.
Does anybody know what joint allows your arm to bend?
Maybe
Elbow.
elbow, yeah.
Elbow.
Yes,
Elbow.
because that the shape L. It makes the
Yes.
shape L. L.
So Ziad, in your picture, you can see two elbows because your arms are behind your head. How about number 10, Abdullah? Make sure to take yourself off mute.
Can't connect.
Rest.
Can't connect you.
Rest.
Abdullah, I can't hear you. Can you read number 10 for us?
Yes. This joint connects your head to your arm. Rest.
Yes, the wrist connects your hand to your arm. Very good. Ahmed, the next one.
Yeah, okay. The joint connects your foot to your leg. Might be heel.
The heel is the back part of your foot, but it's not a joint.
Ankle.
Ankle, yes. The
Ankle,
ankle
sorry.
is the joint that connects your foot to your leg. I almost said head. That's not even close. Your
Okay.
foot to your leg. Hazem, number 12.
This joint allows your leg to bend. I think hippo.
Your hip. Is that what you
Hip,
said?
yeah.
Hip,
Hip,
your hip
hip.
lets
Yeah.
yeah, it does let your part of your leg bend. What about the next joint down below your hip? What's that one called?
Back or really hip.
The one,
I think.
the one in the middle of your leg. The hip is at the top of your leg, and in the middle of your leg you have another joint. What's that one?
I don't know really.
Who knows the joint in the middle of your leg?
Yeah.
Knee.
Knee.
Knee? Yeah,
Yes.
yeah.
All right. Huan, the next one.
This is used to talk.
Tongue.
They could be lips, tongues, or mouth.
Tongue.
Yep. Lips, tongue, mouth, teeth. McKelly, number 14.
This hurts if you have a bad cough. Throat.
Throat.
Yes. Your throat hurts if you have a bad cough. Nice pronunciation there. Okay, so we're going to get some reading practice now, and we're going to cover all kinds of different doctors, so it's going to be difficult. And we'll start with Richard. Can you read the first paragraph for us?
Okay. A general.
Practitioner.
Yeah. Okay. Practitioner, or I can see screen.
Let me...
Okay. Where is it? Or GP is also called a family doctor. He or she can treat most medical problems, but if the patient has a very serious condition, he will often refer the patient to a specialist. Next.
Keep going.
Okay. There are many kinds of medical specialists. For example, pediatrician looks after children. Gynecologist, specialist.
Specializes.
Specializes, for example, in women's medical conditions.
Okay, you can stop there. We'll take another turn. Let's have Rod. Can you read the next section about an obstetrician?
Where is that? Okay. An obstetrician cares for pregnant women and delivers babies. But the cardiologist deals with heart problems. If you have a serious problem with your skin, you can see a dermatologist. Surgeons perform operations. Psychiatrists looks after people who have mental, emotional problems.
Good. And Wolf, can you read the last section for us?
Dentists look after teeth and I don't know how it is pronounced.
Optometrists.
Optometrists check your eyes to see if you need glasses. If you have a serious eye problem, you may have to see an
Ophthalmologist.
ophthalmologist. There are many more kinds of doctors who specialize in different areas of the body. Your GP can determine if it is necessary to see one of these.
Good. What is a GP?
It's a basic doctor. Just you can go around if I mean.
Yes, the general practitioner or the basic
Yeah.
doctor. Good. Okay, Ziad, can you read this section for us?
Where is if you want?
Yes.
If you want to see your doctor, it's necessary to phone and make an appointment. The nurse or receptionist will ask you what the problem is and may ask you to describe your symptoms before she gives you an appointment. If you have an appointment with a doctor and cannot make it, you must call and cancel.
Very good. And Ahmad, can you read the next section for us?
Yeah, okay. If you call the doctor's office and it is closed, there will be an answering service to take your call. If your problem is serious, the doctor will call you back. If she is not available, another doctor will be on call. Nowadays, yeah,
You can stop there. We'll let somebody take over from
okay.
nowadays. Let's have Hazem.
Yes, nowadays walk-in clinics are becoming very popular. You don't need any appointment to see a doctor in these clinics. Many people use this for minor problems,
Minor.
particularly problems, particularly on weekends or evenings when their regular doctor's office is closed. If you have a very serious medical problem, you can go directly to the emergency department of your nearest hospital or call an ambulance.
Very good. Let me have you read this section one more time, please.
This comprehension, or
You,
you do not need any appointment.
an appointment.
Yeah, appointment.
You do not need an appointment. Good. Nice job, guys. Okay, so we're going to look at some questions. What does a GP do? Huan, what does a GP do?
General.
Well, a GP usually takes care of almost problems, but not severe one. So if the patient has severe diseases or serious illness, the GP will not take care of them, and he will recommend another doctor.
Good. McKelly, if a GP has a patient with a serious problem, they'll send them to another doctor. What was the word for that? Do you remember?
He said you, what specialized doctor do you need?
Yes.
So the action of what the GP is doing when he sends you to another doctor is called what?
I don't remember. I should read.
Does anybody remember?
Refer.
Refer. He will refer
Refer.
you to another doctor. Good. Question number 3, Rod. Read the question and tell me the answer. Rod, are you still there? I can't hear you.
Number 3.
Hmm.
Okay, when you phone to make a doctor's appointment, what will the nurse or receptionist ask you? She she will probably ask you about your symptoms and what's happening with you, what's wrong with you, and she's going to make her mind what doctor you need or specialist, I don't know,
Good.
kind of doctor.
And what happens if you call the doctor and the office is closed? Wolf.
You should cancel your appointment for
No, no.
another day.
No.
Close. If you call and the office is closed, you can't make an appointment because they're closed.
But there will be an answering service.
There could be an
How
answering
clever.
service. What is a walk-in clinic? Wolfie Wolf.
What is walk?
Walk-in clinic. I think it's a just clinic, just you can. I don't know actually.
Does anybody remember what's a walk-in clinic?
Yeah. We don't need to make an appointment to see a doctor in these clinics.
Maybe yes.
Exactly. You don't need to make an appointment. You can just walk into the clinic.
Yeah.
All right. So tell me, when was the last time you were sick? When was the last time you were sick, Ziad?
I'm already sick now.
You're sick now. What's the matter with you?
I have, I think, in French it's called a grippe.
You have a cold or the flu.
No.
Yeah, it's flu.
So what are you going to do about it?
I already visit the doctor, but I'm going okay now.
Okay, good. So get plenty of rest and drink lots of water. Wolfie Wolf, when was the last time you were sick?
In fact, I'm always sick.
You're always sick.
Yeah.
Why?
Why? Because I don't have taken treatment these days. Because I don't have insurance.
Are you sick right now? Like Ziad? Are you sick right now like Ziad?
Yeah.
And what's the matter with you right now?
Actually, I'm not sure about that. I can't examine. I'm not professional about it. I need to see a doctor. Because why people go to doctor?
So you're sick right now, but you don't know what's the matter with you, and you think you need to go to the doctor.
Yeah, I'm not sure. Just I'm guess about. I think I caught a cold.
You think you caught a cold. What about you, Rod? When was the last time you were sick?
Okay, last time when I was sick was 1 month ago. I don't know how to say the word ripped. I ripped my vertebra. It's correct that.
Tell us again what happened.
I ripped a vertebra.
Uh-huh. And you had to go to the hospital?
Yeah, I couldn't walk on the street. I needed help at that moment, and I go to the hospital. I spent a lot of money on that.
How did you do that?
Well, it was a change of events because I didn't care myself because my mother always said to me, hey, you can sit in this position, but I think it was the consequences about playing video games in a bad position when I was sitting. Yes.
All right, so lesson learned. Now you know, always listen to your mother.
Yeah. No, I'm living alone, but I'm going to take her advices.
Good for you.
Yeah.
What about you, Raimi? Tell us the last time you were sick. Raimi, are you there? All right, Michele, tell us when you were sick last.
I was sick 1 month ago, and I was cold. I had a fever, and I called my doctor, and he came into my house, and he said me to stay 2 days on the bed, and to have painkiller if I heard something. And before then, I was good.
All right, what about you, Huen?
I think last time I had a cold was last summer.
Last summer?
Yeah.
And what did you do?
I didn't do anything. Just wait for it to pass.
So you didn't go to the doctor?
I didn't.
Okay. What about you, Hazem? When was the last time you were sick?
I was sick from 2 weeks ago. I took a rest and also painkillers, and kept staying in my house. That is all.
Okay, good. And Ahmad, what about you?
Yeah, okay. I don't remember exactly, but I suffered from headache. I went to the doctor. He advised me to quit drinking fizzy drinks.
Fizzy drinks?
Yeah, because he said yeah, that's because of carbonation.
So you love soda, and he said it's bad for you.
Yeah, yeah.
Well, I think he's right. What about you, Abdullah? When was the last time you were sick? Make sure to take your microphone off mute. I still can't hear you, Abdullah. Are you there? Maybe he's having some problems with his internet. All right, let's go to the sentence matching. In section B, you see we have to match the sentences with the correct follow-up sentence. So let's start with Ahmed this time. You're not going to get to do number 1. That's too easy. I want you to do number 2.
Okay. He is a broken leg.
He has a broken leg.
Sorry, he has a broken leg. I don't know. The surgery will be...
No.
No. He should put some ice on it.
I think I'm going to call an ambulance.
Yes, it's better.
Ambulance.
He has a cast and crutches.
He could have a cast and crutches. Yep.
I don't.
I think that's what we'll go with this one. He has a broken leg, he has a cast, and crutches.
What does crutches mean, please?
Crutches are what you put under your arms to help you walk. So you have 2 crutches maybe to help you walk if you have a lot of trouble, or 1, and they're really tall, really tall up to your arms, and they help you
Yeah.
walk when your
Good.
leg is broken.
Okay, thank you.
All right, number 3. Let's go to Hazem.
Yes, I have a bad headache. I think I need to take some aspirin.
Good. If you have a bad headache, you should take some aspirin. What about number 4, Huen?
She's pregnant. She goes to the obstetrician every month.
Right.
Very good. McKelly, number 5.
He needs glasses. The optometrist gave him a prescription.
Excellent. Number 6, Ramy. Ramy, make sure your microphone is not muted so we can hear you.
Hi, teachers.
Go ahead.
I think he has.
Hi.
Ramy, read number 6 for us and tell us the follow-up sentence.
The break for
Ramy, can you read question number 6?
yes, I think he's having a heart attack.
Good.
Going the demonstrative. I don't know. Maybe I'm going to the call an ambulance.
No. Yes.
Yes.
My
Yeah.
teachers,
Somebody's
I'm
having a
going
heart attack. You can call an ambulance. This word here, it's a long U sound, so the U says you. It's ambulance. Ambulance.
Ambulance.
Ramy, can you repeat ambulance?
Ambulance.
I read the question, the answers. I'm going to call an ambulance.
Yes, but the pronunciation here is ambu. The U says you. Ambulance.
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 Thank you, my teachers.
All right, nice job. Number 7, Rod.
He's very depressed. He needs to see a psychiatrist.
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 Yep, good. And yeah, number 8.
This rash is quite bad. He needs to see psychiatrist.
He needs to see a psychiatrist is number 7, for he's very depressed. So what's
Oh.
number 8?
What does mean rash?
A rash is like when your skin turns red and it itches or burns. If you're allergic
I
to
think
something.
you should put some ice on it.
Let's see, did we use that one? No, not yet, but we need that for another one. What would you do for a rash? Who can help us out?
The dermatologist gave me some cream.
The dermatologist gave me some cream. A rash is a skin condition, and the dermatologist is the skin doctor. Nice job. Abdullah, back to you, number 9.
Yes, sorry, I had a problem in the browser. Okay, now 9, he is going to have an operation. The surgery will be next month.
You got it. The surgery will be next month. And number 10, Ahmed.
Okay. Your lip is swollen. You should put some ice on it.
Exactly.
Okay, question please.
Yes.
What do you call that little hair underneath the lip? I mean for men.
It depends. Like if it's on the bottom of their face, then it's called a beard.
Okay, but underneath the lip.
If it's only in the one spot underneath the lip and nowhere else,
Yeah.
just like one small patch of hair,
Yeah.
is a soul patch.
So yes. Thank you.
You are welcome. So we don't have time to read. Let's see what we can get in here before we run out of time. Let's try the fill in the blanks. Ziad, can you do number 1, a doctor's order for medicine?
Just a minute. A doctor order. I'm not sure about that, but I think it's I don't know.
Who can help him out?
Prescription.
Prescription.
A prescription. Ziad, can you read number 1 with the word prescription?
Can you repeat the word, please?
Prescription.
Okay. A doctor's order for medicine is called a prescriptions.
Exactly. Rad, number 2.
There are two basic kinds of medicines. Blank. I don't know. Drugs and blank drugs. Blank drugs are stronger, and you need a doctor's order to buy them.
Say it again. Your microphone's cutting out. Can
There
you
are two
repeat?
basic kinds of medicines: blank drugs and blank drugs. Blank drugs are stronger, and you need a doctor's order to buy them.
Which kind of drugs do you need a doctor's order for? I'll give you a hint. It's the same word as what the doctor's order is called.
Like prescribed.
Prescription.
Prescription drugs and
Yes.
not prescription drugs.
Yes. What is the word for not prescription drugs? Does anybody know that one?
No.
This.
Prescription.
Prescription drugs you have to have a doctor's order for, and for the other ones that you do not need a doctor's order, they're called over-the-counter. Over-the-counter, because you can go to the pharmacy and get them with no prescription.
Free
So-
drugs. I don't know.
Two basic kinds of medicine: prescription drugs and over-the-counter drugs. Prescription drugs are stronger and you need a doctor's order to buy them. So Rod, what are the two kinds of medicine?
The two kinds: prescription and not prescription.
Yep, prescription and non-prescription. Good. So you can call them over-the-counter or you can call them non-prescription. Either way.
Huh.
All right, guys, we are out of time for today's class, so we have to wrap it up. Thanks for joining me today. Hopefully you learned a few new things, and I hope to see you all in class in the future.
Thank you, teacher.
Thank you so much.
Bye-bye.
Bye bye.
Bye.